So our next patient, it's a funny story, her and her husband both have come to me for consultations, and she's the one who decided to go first. But she's coming in for heaviness in her upper eyelids, bags on her lower eyelids, a little bit of a brow descent on the outside of her brows. So we're doing kind of my signature technique, which is a cosmetic upper lid blepharoplasty, and then a hidden incision brow lift, which is my internal brow lift, which is through the incision on the upper lid. So we're not doing any incisions on the forehead at all. That's going to be really nice to give her like a longer result than a traditional blepharoplasty. And I talk to my patients about this all the time, that if you don't address the brow, you're going to have patients who are seeing heavier upper eyelids sooner, and I don't want that to happen to them. On her lower eyelids, she has heaviness in the eye bags, and so we're going to go through the back of the eyelid, which is called a transconjunctival approach, which means there's no visible scars at all on the outside of her skin on the lower lids, which she's going to really like. She has a very nice tan, and she has some melasma, which is basically a change in her skin texture and tone and kind of pigment, and so we're managing that with multiple skin treatments as well. So it's complex. And the last thing we're doing on her is her neck. Like most women in their late 40s or early 50s, she really just doesn't like the way the fullness underneath the chin looks. And it's not just fat, and it's not just skin, and it's not just a loose neck, but she really wasn't ready to do a full neck lift yet. She wanted something kind of minimally invasive and kind of something that's going to make her look better, but not necessarily with a big scar. And so we're doing the MyElevate, the FaceTite, and submental liposuction. So we're going to make just 3 incisions, one underneath each ear, one underneath the chin, and then we will use the liposuction cannula to remove some of the fat. Right before that, we'll actually heat the skin up with FaceTite, which is going to essentially provide energy. And the way that works is really you're placing the energy or the heat on the soft tissue, or the tissue that's right below the skin, and it's contracting it or tightening it, and then over 10 months you're going to just see an improved lifting. It's not as powerful as a facelift or a neck lift, but it's going to give her some added jawline contouring. And at the very end of the procedure, we're going to do the MyElevate procedure, which is a suture suspension. It's going to relax her neck bands in the neck here, and then we're basically going to lift everything up and suspend it behind her ear, which essentially is lifting of the neck, but just without cutting out skin.